Thank you, Mr. Starr. Let's next go to Dr. Bamberger.
Thank you very much for this opportunity. My slides just got taken down. Oops. That's all right. It's a good way to freak someone out. Anyway, it's nice to see you all today. My name is Josh Bamberger. Nope, not that one.
What up?
And I am a family doctor, and I've been taking care of chronically homeless, mentally ill, substance-using adults for the last 25 years. So this is a very broad area that you have brought us here today to talk about, but I want to narrow your focus to a very small section of the population desperately needing housing, which is homeless people. And I'm going to just present to you 4 slides, and 2 of them are brand new, hot off the presses study that no one has ever seen before, that is really an extraordinary new study we're doing in San Francisco that I'm excited to share with you today. Can you hand me that, please? So as a family doctor taking care of homeless people, I've actually failed. I have done a terrible job in these 25 years. If you look at the data on mortality among homeless people in San Francisco who stay on the streets, they die at an average 25 years younger than the general population. If there was any other specialty that I was working in, I'd be run out on a rail. That is a horrible, horrible outcome. To treat people as best I can with all my education, and still people die 25 years younger than the rest of the population. It's unacceptable. And there's some reasons for this. And one of the reasons is the way that we in medicine think about healthcare. This is a study that was done of a new medication produced by Genentech called Avastin. This medication costs $60,000 a year. And what this shows is a Kaplan-Meier survival curve. And it's a randomized controlled trial of the treatment versus placebo. And what it shows is that if you take the medication, you have a 74% likelihood of being alive after a year and 45% of being alive after 2 years. If you don't take the medication, your mortality is higher. You have a 63% chance of being alive after a year and 30% after 2. Now, overall, this $60,000 investment that the healthcare system very happily spends will give each person with colon cancer who is being treated with this illness 60 days more of life. 60 days for $60,000. And we do not hesitate to spend our healthcare dollars on this treatment. And Genentech takes the money and pays back their investors. This is a study that we did in San Francisco among people with AIDS who were homeless at the time of their AIDS diagnosis. Some of them were housed, and some of them stayed on the streets. The top line represents the people who were housed, and the bottom line represents the people who stayed on the streets. What we found here is in this trial, people were likely to survive 39 more months during the 5 years of the study if they were housed. Only 2 of the people who were in the housing group died, while the people who were in the non-housing group, 75% of them were dead within 5 years. And this is during a time when there was effective antiretroviral treatment. Again, housing is a critical factor to be able to improve the health of the people who I've been caring for 25 years. Without it, you're just wasting away your healthcare dollars. You're spending money in a way that doesn't help people, and there would be no other field where we'd be allowed to continue with this just unacceptable outcomes. But when you add the cofactor of housing, people do really well. And there's some other part to this. So as I mentioned, the Genentech product Avastin costs $60,000 a year. Well, here's your new data. It's only 2 slides. I'm going to walk you through it really quickly. This is a study that we are conducting in San Francisco at a brand new building called Kelly Cullen Community, which is a 172-unit supportive housing in the Tenderloin. I'm sure that Mr. Chu knows very well. And this slide represents not the treatment group, but the people who are in the control group. And the reason why this is so important is that every other study that's ever been done of homeless people have shown that if you follow homeless people who are high users of the healthcare system and don't do anything for them, they actually get less expensive. It's called a regression to the mean. In our trial, this is a study where we had 50 people who were not housed, who were randomly selected from a group of high users of the San Francisco Health Plan, which is a managed care program in San Francisco. And over a 12-month period that we followed them, their costs went from, as a total, $1.5 million to $1.6 million for these 50 people who were randomly selected from a group of 30,000 people at the San Francisco Health Plan. And here's the treatment arm. They started out about the same, 1.8 million, and within 1 year, their health care costs dropped to $500,000. Now, look at this. This is treatment as usual. Orange County, Los Angeles, wherever we are, if you don't take care of high-using homeless people who are using all our health care dollars, they just continue to increase their costs. And then if you invest in housing, it more than pays for that treatment. It's crazy that the healthcare sector cannot embrace the idea that housing will improve people's health. Not just will it help them to survive, which is why I went to medical school, not for this, but it also will reduce the overall governmental expenditure. This is your opportunity. Other states are in front of California. New York State has figured this out. With Andrew Cuomo as the former HUD secretary, presently as governor, he's recognizing that investing in housing as a healthcare treatment will not only improve the healthcare of their citizens, but will reduce governmental expenditure. And we have an opportunity here in California to follow that experience. But we need to be specific and targeted. Healthcare is not the answer to all of our social problems, but it is an answer for people who are sick. And if we can target high-using homeless people, people who are in nursing homes who have no other exit except for housing, then we can provide them with the health care that everyone deserves. And we can reduce the size of government. We can't do this for every homeless person, but we can do this for people who are using a lot of our health care dollars. This is our opportunity, and I really look forward to answering any questions that you have so I can try to explain why I think this is such a great time in our government to do what we are all here to do. Thank you.
Thank you very much, Dr. Bamberger. We'll hold all the questions until the entire panel is finished, if that's okay. Next, let's hear from Captain Allred. Welcome.
Good morning. My name is Jesse Allred, and I'm here on behalf of San Jose Firefighters Local 230. And first off, I want to thank you all for having me here today. I have a young family, and like anyone, I want affordable housing in a safe community, with good schools, and near my job. And I work in San Jose, which happens to be in the heart of the most expensive real estate region in the nation. Last month, the median sale price for a home in Santa Clara County was $1.2 million. Now, I was born and raised in the Bay Area, and I would love to live where I work, but I just can't afford it. I make a decent middle-class wage, but it's not going to cut it in the Bay Area for a family of four. I found affordable, safe housing in Auburn, which we love, and the homes in Auburn are about 1/3 of the cost of that in Santa Clara County. The only problem with that is that I'm about 150 plus miles away from where I work. So I think that qualifies me as a super commuter, is what they're calling us. So I spend on average about 2 to 4 hours on the road depending on traffic conditions. And so not only is this a burden to my family, being away for so long, but it's also a burden to the community in which I serve. There's been a mass exodus of first responders in the communities of the Bay Area and other regions throughout the state due to the skyrocketing housing costs, to cost of living. And quite frankly, like we saw on the previous slide at the first presentation, is that the middle income wages are not going up. They're not following suit. So what you get in turn is people looking to have a safe place to raise their family. And they move out of the region, and some extreme, like myself, 150 plus miles away. So not only is this a burden on the family, but it's a burden on the region or the communities itself, because it's going to take a long time for the first responders to be called in, because we could be called in at a moment's notice for a large-scale event, whether it be a natural disaster like an earthquake. So this directly affects the local agency's public service. So I just urge you to make this a high priority, and it sounds like you are, and it's really good to hear. So just really urge to all of you to make this a top priority for not only public safety, but your teachers, your nurses, police officers, paramedics, EMTs, and veterans alike. It's important to keep these people local. They're the backbone of your community. So thank you very much.
Thank you very much, Captain Allred. Next, let's hear from Mr. Michael Davis.
Morning, Mr. Chairman.
Morning.
My name is Michael Davis. I'm a Director of Policy and Planning and Charter Schools with San Francisco Unified School District. And I'm here to share a little bit of information with you regarding how all of these crisis figures that you're hearing relate to San Francisco Unified School District and our teachers and paraprofessionals in particular. Last year, the real estate firm Redfin determined that in California, only 17% of homes are affordable on a teacher's salary alone. In San Francisco, where the median price for a home is now over $1 million, affordability challenges are much worse. According to Redfin, there are 0 homes for sale in San Francisco that are affordable on a median teacher's salary. For us right now, our average teacher salary is about $65,000 per year. That'll be increasing by 3% next year and 5% the year after. But that's where we are now. It doesn't get much better when you're looking at the cost of renting an apartment in the city. With the median rental price of a one-bedroom apartment at $3,120, San Francisco has edged out New York City as the most expensive city in the United States to rent, which you already know. Despite the fact that about 72% of our roughly 4,200 teachers live in San Francisco, housing costs remain a growing significant issue for our teachers and paraprofessionals. A 2013 exit survey of 96 teachers leaving the district found that 45% said they were leaving to move out of the Bay Area, and 11% cited the cost of living or housing prices as primary reason for relocating. 18% said living closer to San Francisco would make them want to return to the district. Roughly 50% of the teachers in San Francisco leave the position after 5 years. The difficulty of affording housing in the city where they teach is clearly a factor. High levels of school staff turnover, particularly in our lowest performing schools, make it harder to build the supportive school communities with well-trained, experienced staff that we need. While there are programs in San Francisco to help people find and attain affordable housing, middle-income earners like teachers do not qualify. At $65,000, they make too much. Many paraprofessionals do qualify for these programs, but they face scarce supply and high demand. Among the 72% of the teachers that reside in the city, many live in fear that they will be pushed out because the rental costs increase so quickly, often with little notice. And there's been, plenty of news coverage of landlords finding ways to evict tenants so they can raise the rents. So what are we doing about it? In response to the looming middle-class housing crisis, FUSD has joined together with United Educators of San Francisco, our labor partners, the Mayor's Office of Housing and Community Development, and experts in housing from national labor groups to find real solutions to keep our teachers in San Francisco. This group was formed about a year and a half ago. Meetings were suspended for a while last year while labor negotiations were going on, and now they have reconvened just last month. We are exploring multiple options, including rental and down payment assistance programs to the creation of teacher housing complexes similar to those in Santa Clara and Los Angeles. Additionally, San Francisco's Mayor, Ed Lee, has pledged to tackle affordable housing this year in several ways, including an affordable housing bond on the November 2015 ballot and reinstituting the Teacher Next Door program, which provides forgivable loans to teachers purchasing their first home in the city. So, looking ahead, as our working group wades through the myriad of opportunities and challenges that federal and state tax housing credits can create, we ask for the assistance of our state representatives. We welcome your guidance, advice, and help as we look at all possibilities. Some particular areas of interest are stopping predatory landlords who force tenants to leave rent-controlled quarters, direction to pension fund managers to prioritize workforce housing for investment, support for housing bonds and investigation of the establishment of state matching funds, and development of a comprehensive inventory of public land that can be used for workforce and affordable housing. That's all I have.
Thank you very much, Mr. Davis. At this time, I'd like to open it up for questions for our committee members. Assembly Member Chu.
Thank you, Mr. Chair. First of all, I want to thank our witnesses for painting the picture of what we're seeing around the state of California, particularly our folks from Northern California and in my district. I have a question for Dr. Bamberger. Your data, your graphs were pretty stunning. I have been a longtime supporter of supportive housing because we do know that it is cost effective, but what you've presented is really quite stark. And I wanted to ask you, it is a little counterintuitive to think about spending money to save money, but you referenced the New York State experience. I'm wondering if you could talk a little bit about what is happening in New York State, and are there creative financing mechanisms to really help us move through what we know are good investments that would lead to better long-rate returns for our budgets?
Thank you so much. It is hard to get your head around this, and there are so many deserving people who need our government funding. What's different about this is the healthcare sector has not pulled its weight. In San Francisco, the city government has invested a lot in supportive housing and basically has reduced the cost to Medi-Cal and to the federal Medicaid system, and they haven't paid their part. So we have to find a way so that the healthcare sector actually is able to use money in its pocket to pay for housing. So to get specifically to your question, in New York State, they projected how much savings was going to be available by investing in supportive housing for the highest users of the healthcare system. And then administratively, within the Medicaid system itself, took that chunk of money and held it in a lockbox so that there could be this flexible housing subsidy pool that developers and people who are wanting a rental subsidy to pay for housing for homeless people could draw down upon that. It didn't take a real complicated social impact bond system that, to me, actually, I just cannot seem to get my head around adequately. So Massachusetts is trying the social impact bond concept, but they're really doing $1,000 per person per year, which just isn't sufficient. New York put $200 million in this year's budget, $600 million in next year's budget, and they are expecting to have that reduction in their overall Medicaid expenditure. They asked the federal government to participate in their 50% in their Medicaid, and the federal government said, no, housing is not health care. So the state did it on its own. And if you look at the costs curve of New York State's Medicaid, you see it going down. They are really getting a return on their investment by doing what we should all be doing anyway, which is to improve the health of people who are living with mental illness and substance use, but they're also doing it in a cost-effective way. So they are proving the concept, and I think California can really follow that forward.
I'll just follow up with one comment that I also serve on the health committees as well as the budget subcommittee that oversees Medicaid, and colleagues in those committees. We're really struggling with the fact that our Medicaid numbers have jumped so dramatically. So I have to admit I'm very intrigued by what you've laid out and certainly would appreciate more information on this.
And we just have to be careful that we don't keep asking the feds for permission because they have some real discomfort in this area for a variety of important and reasonable reasons. But New York State has shown that by getting out in front of that, by creating this lockbox, they can overall reduce the exposure that the state has to these expensive, emergency department inpatient visits that just don't improve the health of the people who I've been caring for 25 years.
Thank you.
Thank you, Mr. Chair, and thank you, Dr. Bamberger. In fact, I had a two-part question, and I think the second part of the question deals with the sample the slide that you showed earlier, which showed the differential between the cost of health care versus for folks who have not been housed versus the folks who have been. Now, the 50 individuals that were taking the samples, were they taken throughout California or with a particular one location?
Yeah, thank you. I'm sorry I didn't explain that well. This was a really exciting study. So we started with 30,000 people who were seniors and persons of disability who were enrolled in the San Francisco Health Plan, which is the public option of the two health plans that are available to low-income people in San Francisco. Then we looked at all the people in that $30,000 pool who we felt might be homeless and were high users of the healthcare system. Then we went out and actually spoke to them on the streets to verify if they were homeless. And we ended up with 110 people who, out of that total 30,000, remarkably, who met our inclusion criteria. Then we randomized them to either entry into this one particular supportive housing facility called Kelly Cullen Community, or we just observed their behavior after that. This slide represents the folks who we just observed, and this was folks who went into the housing. one thing that's interesting, just a side note, we only had 55 people who could qualify for this housing, and 50 of them took the opportunity to move indoors. We would knock on their cardboard boxes on the street and say, guess what, you won the Willy Wonka gold card, you can now move into housing. And we would hold them by hand and move them to that particular facility, and almost everyone moved in. And they're doing, as you can see, very well in terms of their healthcare costs.
Obviously, you kind of kept track of these individuals for how long?
So we're in the third year of our study. This is the first year data. I have looked at the second year data, which will close on July 1st, because that's 2 years after the last person moved in, and the data continues to look very robust and impressive.
Got it. Thank you. If there are no further questions, I want to thank the gentlemen for your presentation. They've been very helpful. Thank you for joining us. Let's bring up the next panel. Our third panel is made of 2 developers with experience building affordable housing who will discuss the challenges of building affordable housing. The speakers are, let me introduce them. Mr. Steve Pontel, who is the National Community Renaissance President and CEO, and Doug Shoemaker, who is the President of Mercy Housing California. Welcome, gentlemen.
Thank you very much.
Anytime you're ready, you may begin.
Thank you very much, Mr. Chairman, members of the committee. It's an honor and a pleasure to be here. Thank you also. I'd echo the previous comments for taking the time to participate in this conversation. What I would refer you to is it's in your packet, but if you want a color version, you can open what we just passed out, and the first insert is just one pager that I'm going to be referring to. You have the opportunity to deal with probably the most critical issue facing the future of California. And I don't want to overstate it, but I also don't want to understate it. When you think about the basic needs, it's easy to boil it down to food and shelter. And so the shelter part of that conversation is something that for some reason we have allowed to get completely out of whack within the state of California. And one of the things to keep in the back of your mind, no society throughout the history of humanity has succeeded by not adequately housing its population. And so this is a significant challenge that somehow we have to get our minds around. And what this infographic tries to do is it actually captures a lot of what was said before. The primary consequences of not meeting the need for housing can be summarized as, number one, overcrowding. You could just imagine if we're 1.5 million housing units short, the number of families that are living in overcrowded conditions. Consequences of overcrowding is the ultimate destruction of our neighborhoods. If you design a neighborhood for population X, you put 2X in the neighborhood, the roads, water, sewer, police, fire, parks, schools all deteriorate faster than they were designed for. And so by exceeding design capacity, not having an adequate supply for the people that are living in the housing, ultimately we're destroying our neighborhoods. You heard about the challenges of not having housing located in proximity to jobs, and you also heard about the challenges that not only is housing a critical social determinant of health, it's also a critical determinant of educational performance. And so in the long run, not meeting the housing needs is having a long-term impact on the state as a whole. 3 primary challenges that we face as a developer. Number one, the opposition to affordable housing. You can call it NIMBYism, you can call it regulatory hurdles, but the challenges we face in building affordable housing, especially in our more affluent counties, coastal counties and communities, but throughout the state as a whole, are significant. And understanding the psychological dynamic associated with the production of affordable housing is an important component of your conversations as we go forward. The second primary challenge as a developer is the reduction in resources, as you've heard some about, and the increasing in costs. And the cost increasing is at every single level of government and every single policy that is passed. Because for some reason an affordable housing project is perceived to be the Christmas tree that every ornament or idea can be hung on and that additional cost can be added. And we can drill into that as well. And then the final challenge is the competing priorities of the various agencies associated with affordable housing. If I were to ask you what is the state of California's priority for affordable housing, there is no answer. There are numerous priorities, and what that creates is conflict at every level, both between local, regional, and state, and among state agencies. And so let me just give you 4 examples on the recommendation side. If I'm a billionaire building a professional football stadium, I can get protection from the abuse of CEQA. And if I'm building affordable housing, those that are opposed to affordable housing can use CEQA to stop us, delay us, block us at every turn. And so there has to be a thought about CEQA is important, it's critical, but the abuse of CEQA to stop projects because people don't like them, they don't want them in their neighborhood, or whatever the other reasons are, is a dangerous precedent that we need to guard against. And on the opportunity side, not only would be to think about the needs of affordable housing and the potential opportunities to reduce the obstacles to affordable housing, but even coming up with incentives and maybe some CEQA waivers or some CEQA streamlining or some CEQA grants that can enable affordable housing projects to move through the process with a level of certainty that reduces the costs. The second example is the opportunity to approve the alignment between various state agencies and state priorities. And we have a list here. I think I have a list of half a dozen different examples. But just to give you, within the state of California, and two of the specific examples I'll share with you, I would argue that the Department of Finance, with regard to housing assets in the state, it does not have a priority for the expeditious releasing of those assets for the production of affordable housing in what are clearly designed and designated as affordable housing assets, which goes head-to-head against the desires of the tax credit allocation, CalHFA, other state agencies' goals of producing housing. Other conflicts occur with regard to the multiple compliance issues, the multiple complexities of the layers of financing, where every agency has their own processes, often redundant and often contradictory. And so the opportunity to create alignment, clarity, certainty, and speed in the ability to allocate resources, limited resources that we have, and understand the true costs of layering on all of the various approvals could make a significant difference in our ability to produce affordable housing. Probably the biggest single reason the state of California, number 3, is adjusting, is out of whack on the production of an adequate supply of housing, is because local government is incented to produce retail sales tax generators. Local government is disincented to produce housing. So the reason we have 2 times the amount of retail built in the state of California and 3 times the amount of retail zoned in the state of California is because local government plays the cards they're dealt. Their primary source of discretionary dollars are retail sales tax. Cities will fight tooth and nail over an auto dealership, a Walmart, or a Costco, whereas a housing development will be layered with every possible nexus fee that can be charged to a housing development. And so until cities are incented to produce jobs and housing and not incented to produce retail, we will continue to have a significant distortion in the ability to produce an adequate supply of housing. And that's a state issue. The state of California sets the local government fiscal policy framework within which cities work. And then the final opportunity was alluded to by the previous panel. There are significant, the conversation that I would suggest is for every state program, the question should be asked, what about housing? If there's a prisoner release program, what about housing? So just as an example, for tax credit properties, certain people with criminal records, primarily felons, cannot live in a tax credit property. So if people are being released from prisons that have certain records and their families are living in an affordable housing development, they cannot move in with their family. Nominal thinking has been put into what are the housing solutions for that population? What are the housing solutions for the homeless, as was talked about before? And so with every single state policy opportunity, there's an opportunity to include the housing question about how are we going to resolve housing for this particular policy. And in the health, I also have the opportunity to serve on the board of the California Endowment, and a huge social determinant of health is adequate housing. Studies will show you people that are adequately housed are healthier than people that are not. People that are employed are healthier than people that are not. LA County's public health department is beginning to allocate public health dollars to help support housing. There are models associated with the ability to unlock the 17% of our economy that's tied up in healthcare to be able to have a positive impact on health. Is just another example of an alignment of multidisciplinary policies. The challenges that you have is the silos are tall and the walls are thick, and people defend their dollars and their territories to their last, dying breath. 2 examples are the next 2 handouts. They're both in the packet, but Downey and Citrus Grove and Rialto. And I brought these 2 examples. These are 2 properties. Downey, we just had a grand opening a couple months ago. This project could not be built today. This is 7 stories, downtown Downey. critical infill development in an area that has significant need for housing, part of the implementation of the downtown specific plan. But as an example, the resources that it took to put this project together do not exist today. Similarly with Citrus Grove and Rialto, this was a neighborhood where the pizza man would not deliver pizza, the mailman would not deliver mail, and the police would not do rounds because of the dangerous nature of this neighborhood. And so our ability to aggregate resources, go into this neighborhood, transform the neighborhood where it's now a safe neighborhood for children to play, families to live, is a result of resources that no longer exist. And primarily, these were done with local government resources and in partnership with state government resources. And as was pointed out by the previous speaker, the local government resources have been eliminated. So with that, I'm going to let Doug fill in the gaps and look forward to your questions. Thank you very much.
Thank you. Let's go with Mr. Shoemaker next.